A 10-year-old boy and a 40-year-old mom are the latest flu-related deaths in the U.S. The CDC says widespread flu activity is now reported in every state except Hawaii. Liz Bonas tells us why this season could get even worse. Liz.
You just don't think that a healthy 40-year-old woman is going to die from the flu.
That's what Walt Oxley says happened to his daughter, Katie Oxley Thomas. He says the California mother of three was in excellent health. She practiced yoga and ran 3 marathons.
She was just in the peak of her life.
Oxley says Thomas visited the hospital twice in 2 days, both times diagnosed with the flu, and then was sent home to rest. She was admitted to intensive care just days later and died within hours.
The flu had gone to pneumonia that had gone to septic shock, and it consumed her so quickly it's hard to grasp.
Thomas is one of 42 people in California under 65 who've died from the flu this season. Nationwide, 26 states are reporting high influenza-like illness activity, according to the Centers for Disease Control and Prevention.
Unfortunately, this year's influenza season is proving particularly difficult.
Over the weekend, 10-year-old Nico Malozzi was traveling with his hockey team in western New York when he was diagnosed with the flu. He died on his way home to Connecticut. At least 22 children have been reportedly killed by the flu this season. The CDC's Daniel Jernigan believes that the number is likely much higher.
These deaths are likely underreported, sometimes maybe half of what's actually out there or even a third of what's out there.
Now, I did check in our area today. Northern Kentucky reports 6 deaths so far from the flu. All have been in adults. Ohio does not require adult deaths to be reported, but says at least 2 children have died from flu-related illnesses. The dominant flu strain circulating this year is a flu virus called H3N2, but health officials say flu B activity also now increasing and making people sick. The best way to protect yourself is still to get a flu shot. You can still get one. And if you get sick, get to a doctor. They can give you antiviral medications to shorten the severity and the duration of the flu. Paula?
All right, thank you, Liz.